Good morning, Crawford Health Centre. Sally speaking.
About a month ago, my wife had a miscarriage and everything seems to have spiralled since that point.
Oh, I'm sorry to hear that.
Yeah, it was a bit of a rough one.
Yeah. Are you planning to permanently live with your father?
Yes.
Is that a good idea?
No, but he's got no one else, so... I really don't want to give it to her.
It's just a big thing, isn't it, having a baby?
It hurts a little bit when
Hurts when I press around this side. I think there are probably a couple of little things going on, and the most likely is that this is Osgood-Schlatter's disease.
Do give me a hand, please. Thank you. That's it. Oh! Oh!
No, sorry. I'm really, really busy. You need to do it yourself.
I need to carry on. I'm doing the emergency clinic this afternoon.
The duty doctor here's had a completely kind of mad morning.
We haven't got any appointments this morning. They're literally completely booked up.
The next available appointment she's got is 3.5 weeks.
I'm running around between the morning and the afternoon to get done, and I'm still staying till 8 o'clock at night.
I just think, you know, we're almost at breaking point.
We're chock-a-block. We've already got about 25 people on at the end of surgery already.
Looks busy today.
It's always busy here, isn't it?
I mean, obviously it's always busier in the winter, but it does feel at the minute that it's kind of a bit out of control, as opposed to, oh, it's just a busy day. You can kind of suck that up.
I've got all these urgent tasks. I will just do one at a time.
We must be near the bone now, because there's not that many that I see where I think, oh, come on, you know, this isn't an urgent one. They're people who genuinely do need to be seen.
Yeah. So these are all new patients. We had 6 Monday morning and 9 in the afternoon.
They're definitely on the increase, I think.
Yeah, I've gone through that script so many times today.
Yeah.
I'm actually out of breath.
I would like to have a thing where we say, right, well, we've reached this number of patients. That means we need this number of sessions now. Because I think we get to breaking point and we think we need another doctor or urgent care. I don't think we should come to breaking point.
Poor old Farida. Virtual surgery for tomorrow is nearly full.
I haven't even looked at it because I know it's long.
OK, bye-bye.
Hello, how's it going?
Crazy.
We can only do what we can do.
We can.
And if we do an excellent job, I tell you.
I agree.
Maisie, please.
Holly, can you grab me a plate, please?
Hi there. Right, I'm one chair short, so maybe you...
Oh, the little ones can sit there, you're fine, and Maisie can sit on there, and I'll hold on.
OK. There we go. And your mum, I presume. Yeah, OK. Right, so what can I do for Maisie?
I had a phone call from school saying she's hurt her neck quite badly. She flipped over and landed on her head, and she was acting funny.
Do you want to do some drawing or something, girls? Yeah. Right, I want the best drawings of your school. One for you and one for you, OK? So you called from school, she hurt her neck.
And she was acting funny in class. She can't move her head.
Right, so you look like that hurts. Yeah, you're being really brave, though. Well done. So can you remember what happened?
It was the end of lunch.
Right.
I went over to see my friends because I was playing football.
Yeah.
She asked me if I wanted to do a flip, and it ended on my neck weirdly.
And have you had any painkillers at all?
Paracetamol, ibuprofen.
Paracetamol and ibuprofen. Well done. Why did they think she was acting funny in class?
She just said she was a bit disorientated and, like, I don't know, just not herself. And then she said she didn't feel right when she was in the car on the way down there as well.
OK.
Have a seat.
What's been happening?
This is for you.
Thank you very much.
I had an accident last week. Cracked my head open.
Oh, no, what happened?
We were at the pub. I wasn't that drunk at the time, but I don't remember anything post-headbang. And I was in A&E for like 5 hours.
Really?
Yeah.
Oh, right. Oh, that's quite a long time.
Yeah. So I scraped my head down the side of the door and then smacked it. So I've got a staple in the back.
You don't remember what happened at all? What did other people say happened?
I tripped, and then they just thought I was on the floor laughing, and then they saw
Realised
a trail of
you
blood.
You were unconscious.
Yeah.
Dear. So was everything OK at A&E then?
It was OK at the time. Apparently I wasn't slurring or anything. But then the next day,
Do you want to have a seat on the bed for me for a second?
And the next day I started going really dizzy and felt really sick and I had to go back. So I said I had concussion.
And what did they say about that?
So that it's normal side effects for a head bang and it could last like up to a week.
And is that settled now?
Yeah.
So you still had any headaches or anything now?
Yeah, so when I've not on painkillers, it still hurts.
Hurts here where you've hit it?
Yeah.
No headaches anywhere else?
No.
OK, so this has healed really well. Are you squeamish at all? Are you all right just sitting there? All this does is literally just pinch it in between and bends it so that it just comes out.
OK, cool.
All right. Do you want to lie down at all?
It's really painful. No, I think we're OK. Oh.
You sure?
Yeah. It's out.
No, not yet.
Oh, no.
I'll tell you what, it's probably going to be easier if you lie down because you'll probably be able to keep more still then. That's better.
Yeah.
It's going to be better. Need to get underneath it. There we go. It's out.
Yeah.
Right, just stay there for a minute. Don't want you getting up and passing out.
Oh, is it bleeding?
Tiny dot just where the staples come out. It all looks absolutely fine. Don't pick at the scab. If it's a bit sore now, just take some paracetamol, some ibuprofen.
OK.
If at any point it starts getting more tender or hot or swollen, any signs of any infection, then let us have a look at it again. But otherwise, it should be fine.
Okay, thank you.
All right, be careful with your head.
I will. Thank you.
Right. I'll see you later.
When you had this flip, you didn't pass out, as in fall asleep or anything like that?
No.
No, good. You didn't vomit?
No.
OK, and where does it hurt?
She said she can't move her neck.
Well, about...
At the back. OK. Yeah, all right. So I'm just going to gently feel down your spine. Is that all right? So what year are you in now?
6.
My son's gone into year 6. And what's the most fun thing in year 6?
PE.
PE, good. Right, that feels good. OK. Right, let's see how much you can move your neck for me. Can you put your chin on your chest? Excellent. Can you move it right back? It's a bit stiff, is it? OK. If you feel my fingers in your hands, right, how hard can you squeeze me? It's a time you can really hurt me. Really hurt me. Really hard. Go on, go on, go on, go on. Hard, hard, hard. I want to cry. I do want to cry. OK, well done. And does that all feel normal?
Yeah.
Fantastic. Right, OK, I think she's sprained her neck, OK? So the important thing is exactly what you've done, paracetamol, ibuprofen. Hot baths tonight, hot water bottle, and then keep moving it. So, things... Oh, that's beautiful. Fantastic. Right, so things I'd worry about is she starts vomiting, drowsiness, just not herself, that sort of thing. Keep a close eye on her, but I think it's just a neck strain. Right, girls, have you got everything to take with you?
Water bottles and coats, please, girls.
I'll get the door for you. All right, well done, sweetheart. You're being really brave.
Thanks.
OK, all the best. Bye-bye.
So is this your mum?
Yes.
You brought with you? Yes. And your baby?
Yeah. Basically, I spoke to the health visitor because I'm getting this pain in my nipples, my areola, and sometimes kind of in the breast. The health visitor mentioned it could potentially be thrush.
Yes.
She doesn't have any white in her mouth.
Yes.
But then someone said, oh, that I might not have passed it on to her yet. But...
Can I just have a very gentle feel just of the breast? Sorry, I can see there's no sort of redness.
I mean, it hasn't been as bad today. Last night it was horrible.
Yeah. Look at the other side just to...
This one is starting to ache now.
Yeah. And the nipple itself is just slightly less red on this side, isn't it?
Yeah.
Yeah. That's fine. You can put your things back on.
I just really don't want to give it to her.
Yes, yes.
Thrush.
I'm just going to get up some information we've got from the Breastfeeding Network, because it's thrush in the breast is really prolonged treatment to kind of get it right. And thrush infection can affect a mother's breast while she's breastfeeding. Pain is severe and can last for an hour after every breastfeed. It should be confirmed by a swab of your nipples.
Oh, that's just annoying, though, because it means I have to go on with the pain.
Are you taking any pain relief? Yes, I know it's hard, isn't it? I don't want to rush into treating something if it's not what it is. That's my concern.
I mean, I don't want to have thrush.
Yeah.
I don't want it.
Yeah.
I don't want the pain.
Is he bottle breastfed?
And bottle.
Bottle, fine.
You're looking very well on it, young man, aren't you?
Oh.
She looks a very good size.
She's a boob monster.
She doesn't eat particularly well, but I think that's because she drinks so much milk.
Gosh, she's all breast milk.
Yes.
It's amazing, isn't it?
Big boy, aren't you?
Yeah.
Just feel pressure to always breastfeed.
Yeah. You feel like you've really got to prove a point.
Yeah.
I can do it all.
I can do it, I can do it. I'm cleaning, I'm doing this, I'm doing... When in actual fact, she's just sat
Sat on your bum and cuddled him. Yeah.
Are you breastfeeding?
Yeah, but only at night.
Just sort of one feed at night at this stage?
I wish.
Some
Probably
feeds
more
in
like 3 or 4.
Really? Okay,
Yeah.
okay.
Eating and drinking?
No, he's gone off his food today and he's breastfed, but at this age you just don't know whether they're doing strikes or whether they're just...
Let's take some swabs then today, yeah? I hope that's not painful, just...
It's not too bad. It's a little bit tender.
Yeah.
That's
fine.
fine.
That, okay.
Last night, I could barely roll over, and it was so tender.
Pain in breastfeeding is common, so women shouldn't feel that they're doing something wrong if they experience pain when feeding. Mums experience pain for several reasons. The most common problem is positioning of the baby, so that the baby isn't positioned on the breast quite correctly. Another common problem is thrush, and that can cause discomfort to the nipple, but also it can cause coating and discomfort to the baby's mouth. And then the third problem is mastitis, which is generally a bacterial infection in the breast, which makes mum feel extremely unwell and makes the breast very tender.
I mean, have you got any thoughts on what else it could be if it's not thrush? I mean...
It does say if swab's positive, rather than doing it before we know, in terms of treatment. Take some pain relief. The other thing that helps is cabbage leaves.
Yes, avoid cabbage only.
Before I do anything else, can I just whiz these up there because I don't want them to miss the collection.
What's supposed to be in the cabbage leaves?
Apparently it makes you smell like cooked cabbage because it gets all warm and floppy in there.
Right, I must just put the request on the system.
That's
then
fine,
I can
don't worry.
Printed, so I'll just do that now.
Oh, no.
So, don't worry.
I know, it's
I'm
just
sure it
so
will be
much
fine.
things to worry about.
Yeah.
And then... Sorry. Try not to get upset. I just... Yeah, I just don't want to be worried about, like...
It's just a big thing, isn't it, having a baby?
I really don't want to
give it to her.
We're told that breast is best, but that's not always the case for every woman. For some women, formula feeding is the right decision for their own welfare and for the health of their baby, and women should be supported in that decision.
And who's at home?
Well, I am this week.
But yeah, I've got lots of support around me.
Yeah.
And stuff,
Lots of
so-
friends with babies, haven't you?
Yeah, so I think I'm just tired, so
Yeah.
it just catches me out.
Yeah.
Thank you so
OK,
much.
all right then. OK, lovely.
Thank you.
OK,
Have
nice
a nice
to meet
evening.
you. Bye-bye.
Oh.
So will your son get involved with that then?
It tastes like soap.
I thought it was sugar.
It's soap. That's all right.
I meant to warn you because I was like, it might be salt because it was in the cupboard in a little jar.
That's soap, yeah.
Sorry. Come on in.
Thank you very
Have a
much.
seat.
After you. There you go. Long time no see.
Yes. How are you doing?
My father's just come in Wednesday from 13 and a half weeks in hospital for 3 bleeds on the brain.
Goodness.
I'm moving back home, but he seems to push all the wrong buttons with me.
Right.
And I lose my rag so quick with him.
Right.
Is there something I could do for that? Anger management course or
Right.
something?
Yeah.
Because he certainly knows which button to push when.
Right. And you planning to permanently live with your father?
Yes, unfortunately. I mean,
Is that a good idea?
no, but he's got no one else, so... Well, it's a case of them wanting to put him straight in a care home, and he said, no, I want to go home. And it was
Yeah.
like, because you're going to be there on at night time all on your own.
Yeah.
Your word, so just
So
go
you're
back.
going to give up your own place?
Yeah.
Yeah, I don't know whether I've mentioned it before, but in Bristol there is something called the Bristol Wellbeing Therapy Service, which is a service which provides talking therapy for
Okay.
people with lots of different issues,
Yeah,
but
yeah.
it does include anger difficulties. Yeah. So you're essentially going to be his carer. So we'll put you down on our carers register.
Okay.
Okay. You are eligible to a carer assessment,
Right.
and you can access that through something called Care Direct,
Right.
which is the Bristol Social Services. And you've presumably thought through absolutely all the options apart from moving in. Yeah. I mean, it might not work out.
I know. I've got to give it my best shot,
Yeah,
haven't I? So.
yeah. That's a few suggestions.
Okay.
Okay?
Yeah, brilliant.
Good.
Thank you very much.
Nice to see you.
And you. Lovely, thank you.
Okay.
All right, thanks a lot.
Bye now.
Cheers, bye-bye.
Right, what can I do for you?
I'm getting kind of random days of nausea and just kind of tummy uncomfortableness. It's very much like between my belly button and my rib cage, and it's just really sore and tender. And yesterday it was so uncomfy that I didn't go to work, but there doesn't seem to be really a pattern to it, and it will just flare up for a few days. I'll just feel nauseous for a few days, or I'll feel really bloated for a few days. That doctor before said that it could be kind of IBS type
I think
thing.
that's the most likely.
Yeah. But it's just odd that it doesn't seem to happen kind of after any specific food. It's just...
Doesn't have to. It is one of those things that can just come out of the blue. And you can look at your diet, you can look at your stress levels, you can look at lots of different things, and you can't always link it. And it's just learning to manage it, really. Some people find exercise or just generally help relieve the symptoms. Yeah. Some people find that avoiding certain foods do help, but not everyone.
Yeah.
And do you suffer with anxiety? Yeah. Do you think it is related to when you have more anxious or busy days?
Possibly. I'd had like a bloated tummy all day on Monday and I felt really uncomfy. And I just got home and I just burst into tears and I just cried pretty much all evening. And I was sort of saying, I can't do it tomorrow, it's too much. But I don't know whether me feeling unwell made my anxiety worse or my anxiety made my tummy worse.
I suffer with IBS more I used to than I do now. And I used to wear different size trousers on the day where I was busy because of the anxiety and your tummy swells and that sort of thing. And many people suffer like that. And it's just learning to adjust, really. But how much is the anxiety affecting you now?
I mean, it does definitely have an impact on my life.
Yeah.
I did CBT in autumn last year.
Great.
You know, you're going into it with such high expectations, and obviously I just came out feeling, I'm not healed yet.
I mean, do you think any further talking therapies would be helpful?
I think possibly it could be something that wouldn't do any harm.
Yeah, absolutely. So there's two options. One is a course, so have a little think about that. Yeah. Or if you want sort of to consider other options, Bristol Wellbeings. Yeah. Okay. Shall we have a quick feel of your tummy? Yeah. Any pain at the moment?
No.
OK, I'll just have a little feel
I could feel it was a bit tender this morning.
Right, OK. Yeah, that's fine. Yeah, OK. So, yeah, things I would worry about. Losing weight.
Yeah, no, that's not a problem.
Worsening symptoms, regular diarrhoea, blood in the diarrhoea. Okay. Those are things that would make me worry.
That's great, thank you so much.
OK, no problem.
You're not allowed to eat.
Yeah, you can eat, just can't be on your phone. You can eat to your heart's content.
A banana can't offend anyone.
Eating is quiet, you see. You can keep your banana, it's too healthy for us. We just have a drawer full of chocolate digestives.
How can I help?
The reason I'm here is I'd like to sort of find out more about my nasal problems, which I have.
Yeah.
As you can see, I've got quite a crooked nose.
Yes.
I fell out of a tree when I was very young, 4 or 5 or even less, and I chopped my tongue off basically and broke my nose at the same time.
Yeah.
Ever since then, I've had nasal problems. Generally, my nose is just constantly running. It's actually interfering with my work. I'm driving on a machine and I have to stop normally every couple of minutes and blow my nose. Is it the seasons? Because it does seem to be seasonal, especially when it's hot.
Have you tried things for
I've used
seasonal stuff?
Yeah, I've used antihistamines at times.
Do you think it's helped when you've taken
Well, I
an
did take it the other day. It seemed to help a little bit.
So I think I'll have a look up your nose, all right?
Yeah, of course.
Can you just put your finger on one side of your nose and just blow? So let's just close that one.
That's a good blow.
So if you just look up at the ceiling, just look in this one first. That looks pretty OK. And the other one? Yeah, you clearly have an anatomical problem, from your fracture.
Yeah.
And it is a bit difficult to know how much of this is due to that and how much of it is due to some sort of what we would call sort of allergic rhinitis, which is just inflammation of the nose lining.
Ideally, I'd like to go down the herbal route if possible, not the genetic medicines route.
So the first thing to say is that I have no qualifications on herbal remedies, okay? So if you want to go down that route, then I think you need to probably seek that out outside of the NHS, okay?
That's fair enough.
I would go straight for a steroid nasal spray, okay? And give you a trial of a weaker one for a month, and then maybe a slightly stronger one, and you could add into that an antihistamine. I would actually try all of this first, because in many ways it's a good idea to avoid surgery.
Yes, I agree.
Because it is unpleasant to have basically your nose rebroken and straightened, which is what probably might need to happen.
That's what I've been afraid of all my life.
But if it stopped you having this problem, it might be worth it. So why don't you have a go with some of these things and book a telephone appointment to let me know how things are going in maybe 4 to 6 weeks. Is that okay?
Yeah, it's perfect, yeah.
Okay.
Thank you very much.
Great. Okay, nice to meet you. Okay, bye now.
Bye-bye.
Well, my kids asked their ass off at me. They said, Mum, do you know what? Years ago, you never had hardly any pills, did you? I said, no. I said, but as soon as I got over the age of 50, I said, you got every bashing pill jumped out the woodwork. And I got it all.
Diana Drew, please.
Yep, you can have me. Just kill me later, love. Oh.
Have a seat.
Just shoot me now, dear. Oh.
Right, so what can I do for you?
Well, I've had 2 falls and it is driving me nuts and my foot keeps swelling up and it goes right up to my knee.
Right.
And I just don't know what else to do. I had an x-ray a little while ago and it's through wear and tear, the knee. And I've been popping the pills and I feel absolutely whacked out.
So you've fallen and your foot is swollen?
Yeah.
And has the swelling been coming and going? Or
yeah, it's been coming and going.
Have you tried taking anything for it?
Yeah, I've took tramadol and I've had paracetamol as well.
And has that helped at all?
The pain goes away for about an hour or so and then it comes back.
Can I have a little look?
Yeah. But
so you'll need to take your shoe and sock off and your trousers probably if you come behind here.
Yeah.
It's worse if you're standing on it, yeah? Yeah, I can see that. OK, don't fall off. That really wouldn't look good, would it? OK, right. So bend this up for me. And where's that painful?
All down my leg.
All down your leg?
Yeah, yeah.
Oh, it's very tight at the back of your leg, isn't it?
Yeah, and it hurts like mad.
Yeah. OK, are you able to stand up so I can feel the back of your leg? Have you ever had a clot in the leg?
I don't know.
Not that you know of?
No.
It hurts me just putting the tape measure on, does it?
Yeah, yeah. Even when I go to bed, I get a lot of problems.
I'm concerned that it's very tender on the back of the calf, and I'm concerned there could be a blood clot there. You've been to school in your nice school uniform. You look very smart. I love your belt.
Hello. What school have you just come from?
San Bonaventure.
Do you like it there?
Oh, yeah. No, no.
Not today, we don't like it. OK.
Is it not school today?
No, they've got an in-service day.
I thought I'd seen a lot of children from there today.
That's all right, I think we get girl time.
Oh, that's nice, isn't it?
So who does your beautiful hair?
I go to the salon.
Yeah? Does it take forever?
Not really.
No.
What's your favourite subject in school?
Maths, English.
And how old are you then?
3.5.
Does that mean you'll be starting school this year?
Yeah, and it's in September.
In September? Wow.
So her knees, basically, nothing major, but every so often she finds if she's running or something like that, she'll just suddenly twist and it'll give her a lot of pain.
OK.
Is it mostly your left knee or both, or evenly?
It started off most of my right knee, now it's mostly my left knee, so...
Can you roll your trousers up? Let's have a look. And what about this side? Let's have a look, compare the both together. So what I want you to do is stand up for me. Can you hop? And then hop. Go on, give it a really big hop. And hop on the other leg. Excellent. And have a seat now. Let's have a little look. Bend it. That's fine. Let's stretch the ligaments. It's not bringing it on.
Okay.
A little bit.
Where does it hurt when I do that? If I push here, where does it hurt? Around the front. But it's moving normally, isn't it?
Yeah.
And I don't think there's any extra fluid in there. Have you been growing a lot recently?
No.
No?
She has shot up a little bit in the last, sort of, not necessarily in the last couple of months, but certainly over the last...
Which year are you in now? Year 4 or year 5?
Year 6.
Year 6? Oh, well, I'm sorry, that was no good, was it? I tried to guess. I think there are probably a couple of little things going on, and the most likely is that this is Osgood-Schlatter's disease, which is a long medical name, but it really just means growing pains. There is also on this knee, when I stretch this ligament, a little bit of pain as well. And the ligaments are the things that hold the bones at the top of your knee to the bones underneath your knee to stop it moving sideways. And if you sprain those, they get a bit sore. But I think the majority of the problem is this Osgood-Schlatter's thing. It's a really common problem and often affects teenagers and people as they start to grow fast because the ligaments need time to stretch as your bones start to grow more quickly. And I think that that's probably all this is. What I'm going to do is write things down for you so you can go and have a read about it. Okay. Suggest that you use lots of ibuprofen when it comes on. Okay. And it usually just settles down with time. Is that okay? Yeah. Nice to see you. Yeah.
Thank you.
Cheers then. Bye-bye.
I'm concerned there could be a blood clot there. OK.
Yeah. Thank you.
Bear with me. What I'm going to do is ask Sue, one of our nurses, to do an instant blood test that we can do here. It's a little blood sample like what you do when you're diabetic, yeah? And it helps us work out if there's any sign of a blood clot in the leg, OK? And then, depending on that, we'll see whether we need to arrange a scan. Is that OK? Because I'm concerned how tender it is, OK? So if you come with me to the treatment room, Sue will do that for you now.
All right.
OK. Does it hurt here anywhere?
Ow.
Yeah, OK, sorry.
Yes. Okay, sharp scratch.
Ouch. It's very painful.
I'm going to take them out and I'll keep going unless you say stop.
Oh.
Sorry, got 5 left to go.
Is that hurting there?
Yeah, ow.
It's quite painful for you, isn't it?
Oh, yes. Yes.
Any pain along here at all?
Ow, sorry. Yeah, that bone.
And just hold them strong, Jackie, all right? Ow, 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 ow. Right. Ow.
How are you, Michael?
Struggling, very difficult.
And you've been troubled with this hip pain, and you went to A&E with that, is that right? Tell me what happened. Why did you go
Basically, I was running, and something was on the pavement. I stepped on. As I was falling, I tried to control my fall.
So you went on your right side?
Yeah, and I spun. But what happened was the contact to the ground was just there by the joint. And straight away, I felt like my leg started like doing that.
They checked you over, and luckily the x-rays were all OK.
It's just unbearable sleeping.
And how many tramadols are you taking at the moment?
I finished what I was given. 2 tramadols, 2 ibuprofen at the same time.
And I've signed you out from work, but I think you might need longer than what we've given you.
I do need longer because the sort of work I do in work, I'm a team leader and I run the shop.
What might be good, Michael, before we talk about that, is if I examine you.
Yeah, please.
Is that all right?
Yeah. Oh. Okay. Oh, yeah. I can go up to about there, yeah?
Do you want me to help you move it up?
Yeah, moving it is not a problem. You can move it, yeah.
OK.
Ah!
Okay. I'm sorry.
No, it's not your fault.
Only do what you're comfortable doing. Can you lift this leg in the air?
No.
Can you bend the knee for me?
I can do like that. That's all I can do.
So if I do it,
yeah,
I don't want to cause you pain.
No, you do it. Yeah. Ah!
That causes
Yeah.
Okay.
Yeah.
If you sit up for me now, because I don't think we're going to be able to do much more.
Could you give me a hand, please?
I will. All right.
Thank you. That's it. Oh, that wasn't you. That was just me.
Okay. So, Michael, looking at what you're able to do.
Yeah.
And talking to you, and from what's in the notes.
Yeah.
It is getting better.
It is getting better.
But you need to have more time out from work. Tramadol's quite a strong, what we call opiate. And I don't think that knocking you out with something even stronger than that will help. I think we need to continue it for another week with some ibuprofen, as long as you're not getting any acid or heartburn with ibuprofen. It would be good to get a physiotherapist to see you.
But have you seen the X-ray?
Yes, I've seen it on here.
I'm not a physician, but the gentleman who saw me was like, come on, you are ex-army, you have strong bones, nothing is wrong with you. You can walk.
The X-rays have been looked at by the radiography department because I've checked the report. So I think they're okay. I think we'll reassess it in a week, keep with the painkillers. I'm going to give you a note, which will sign you out for 2 weeks at least, and we'll reassess the situation in a week.
And
the important thing is that you're resting. If you don't move at all, things stiffen up. We'll be in touch then in a week, OK?
Thank you.
Take care. Bye-bye for now.
The reason I've come down is I've got 3 cousins, and my last cousin now has also developed breast cancer. So that means there's one from each of my uncles and aunties has now developed breast cancer. That concerns me for myself, obviously, but also it concerns me for my daughter.
Let me get a piece of paper and just be absolutely clear.
My sister has also had it as well, so that makes her...
Perhaps... OK, all right. So you're 73. OK, and your full sister has had breast cancer? Yes. And what age was she when she was...?
She had it, I think it must be about 10 years ago, and now she's 66.
56 at diagnosis.
Obviously, alarm bells are really going now.
OK. There are guidelines, which I'm going to look up in a minute, OK? Have you had your mammograms regularly when you were...?
I had one, I think 18 months ago now.
And that was normal?
Yes.
And do you have any symptoms at all?
At the moment, one boob looks smaller than the other, this one. But I've always had problems with one boob. It's like a gland thing, I think. OK. And a little bit tender around the edges here. I've had a good feel around, but then I know you can't always feel the lumps anyway.
OK, we haven't specifically got a lump or anything at the moment, obviously. You would have said that at the outset,
I haven't felt one,
no. OK, I understand what you're saying. Let's have a look. Gloria came in to see me because she wanted me to refer her to the Clinical Genetics Service, which provides counselling and diagnostic testing for families and individuals that may be at risk of a disease that has a genetic cause. If Gloria is found to carry the gene, then she will have to have some counselling about what she wants to do about that. I'm sure at the very least that would lead to her having perhaps an annual mammogram. In rare cases, when the risk is considered to be extremely high, women can be offered preventative surgery, such as mastectomy. There are very specific guidelines, OK? So this is you at the moment. You don't have a personal history. That means you personally don't have breast cancer. Yes. Right, has there been any men with breast cancer in your family?
No, not that I know of.
Any ovarian?
My mother had ovarian cancer.
Your mother had ovarian cancer?
Yes.
OK, all right, OK.
And she had that when she was in her late 40s.
1 first degree with bilateral, 2 first degree. Yeah, OK. You meet the criteria for referral.
Yeah.
OK?
Right.
Is that all right?
Yeah, no,
and
that's
actually,
fine.
So will your daughter,
Yes,
therefore.
and because she's got 2 little girls as well.
Take it one step at a time.
We all have girls as well.
I can only act for you.
Yes, that's right.
OK?
No, then I can pass
you
my
can
information
talk
on.
to your daughter. OK? Is that all right?
Yes, great.
OK?
Yes, that's lovely. You're very helpful. That's great.
Right,
Thank you very much. Thank you.
Pleasure. OK, all right, well...
Yeah, thank you.
I hope everything's OK. All right.
Bye-bye.
Bye-bye.
Come on in, come and take a seat.
Okie dokie.
Right, how are you? I haven't seen you for a while.
Things have been up and down since I last saw you.
OK.
Things were getting better, and then about a month ago, my wife had a miscarriage, and everything seems to have spiralled since that point.
Oh, I'm sorry to hear that.
Yeah, it was a bit of a rough one.
Yeah. How many weeks was she?
6.
OK.
Apparently it failed to attach.
OK.
I don't know what the hell it means, but there you go.
Was that the first time you've tried for a pregnancy?
Yeah.
So it's extremely common to miscarry. I mean, 1 in 3 pregnancies end in a miscarriage.
Oh, yeah. A lot of people have said that one, but it's affected me quite heavily. I blame myself for what happened, which I shouldn't have done, but...
Why do you blame yourself?
But when she thought something was going wrong, I told her there's nothing to worry about because it didn't seem like it was, and she was getting completely worried. And at the start of it, I was like, well, you got a scan on Wednesday, don't worry about it, go then. It got worse, and I feel like if I told her to go sooner to the hospital, maybe something could have turned out different. I know that's not true.
No, that's not
But
true
it's
because
easy to blame yourself when it comes to things because it's just like turning around and going, I told you it would be fine, it wasn't, and everything went to hell.
Is your asthma okay?
No idea how it's going because I can't see inside my own body.
We're actually looking really good.
Does that mean I've got to do gardening and things like that?
Yes, David, you do have to do gardening.
I do have to do gardening, oh dear.
In my mind, when I'm in charge of the world, which won't be long, I will have it so that all the patients have all of that information. You've been super good, haven't you? I haven't even said hello. Just bear with me.
He's nice, isn't he?
Yeah, he's
really nice.
Hello, that's a nice smile, isn't it?
How does your chest feel, though?
Very bad.
I think you sometimes make a big deal of things, am I right?
Yeah.
Hi.
Hi.
Come on then. Have a seat.
Oh.
Hi, Ben.
Hi.
Thanks for waiting.
That's all right, no problem at all. It's just a quick thing, well, hopefully a quick thing, but a couple of weeks ago, I got this random bruising on my finger.
Yeah.
Initially, I thought it might have been a very weird suntan, because I'd just been in the sun, but then it hasn't gone.
Okay.
And it doesn't hurt. It's not that I banged it or anything like that. So I was just wondering what it is. And it kind of feels like it's spread a little bit as well.
Have you tried anything for it?
No, because I tried to look online to see what potentially, like, Britain, everything it said it was, you know, broken finger or things like that. I was like, definitely not that.
And how long has it been there?
Around about 2 weeks.
It seems like a little bit of a line there, and that's why I was putting your fingers together. Sometimes you get a mark where you've got something on it, whether there was some protection, because it is just on the top.
Don't know what it is.
So I don't know what it is. One of the joys about being a GP is that you often are faced with not knowing what something is.
Yeah, no.
And therefore that is tricky. And of course, it may well be that it's nothing will just settle down. It may be that it's going to spread and change. And the third way is that it's going to stick and we have to make a plan about what we should do about it.
Sure.
Given that it's not causing any symptoms, that's reassuring to me, though, because actually it buys us some time. And as long as there's no other symptoms with you and you're well...
As far as I know, nothing,
then perhaps what we could do is either choose to watch and wait for a little bit longer and see. Now, I appreciate it may be spreading, and if it's getting much, much worse, then we would send some pictures of it off to the dermatologist. Or we could try some steroids for it, because there is a bit of redness underlying it. It may be that it's some sort of eczema dermatitis, and that might help it.
Yeah. I mean, what treatment would you think?
I think if it was me, I would take a prescription for some good steroid and give it a try if things are still spreading or getting worse this time next week. And then if it's still no good and it's been there for a month,
then
come back and we can have a...
Okay.
Does that give you some...
Yeah, no, absolutely, that's fine, yeah.
But it doesn't look like anything medically worrying?
It isn't, like the Black Death or whatever.
I don't think it's that. No, unless you've been bitten by a rat, then...
As far as I know, I haven't, yeah.
If everything has got completely better, then we'll put it down to experience and no further action.
Yeah, thank you very much. Cheers. Yeah.
If you're going to miscarry, you're going to miscarry. There's nothing that we can do to stop it. Early stage, at 6 weeks as early, is also quite common. It's also nature's way sometimes. If the egg and sperm haven't met properly, then...
It's stopping something worse happening down the line.
Yeah.
When everything happened, I fully understood straight away it was going to happen. You know, unfortunately, the emotion side kind of trumps logic. And
yeah, it does, yeah.
I ended up beating myself up a little bit.
And have you heard from the autism service and that side of things?
I haven't as yet.
Is any of that playing on your mind, or...?
I suppose it was worried that being autistic might carry down the line. It might be something that I'd be putting on someone how I was going to deal with that in the future, but I'm going to have to learn to deal with it.
I think it would be helpful for you to explore that fear. What about family support on your side?
Family's been wonderful. My mum's been looking after me as much as she can.
Do you think counselling would help you?
I think being able to talk to someone might help a little bit.
So it comes under Bristol Wellbeing Therapies and you can self-refer. And you can either phone or fill out a form online. So I'm sorry that's happened.
Yeah.
But it's not something that you could have changed or had any control over.
I get that. I think it was just the worry, and I suppose when you have something happen, you want a blame. You want a point to pick up and say what caused it. And I think at the time it was easier just to assign myself blame for what happened than anything else.
Try and turn it positively that actually can fall pregnant, we'll try again. And it's nature's way sometimes if things haven't worked out. Yeah.
Thank you.
All right, so I'll see you back in a month or so.
See you in a month or so.
Yeah. Take care. Bye-bye.
Bye-bye.
Got an appointment at 4 o'clock with Elaine.
OK, let's have a look. Your name is?
Jones.
I haven't got you down, Mr Jones. Not for Linda.
Elaine is.
Oh, Elaine, that's why I can't find you. I came to work without my brain this afternoon. If I had a brain, I'd be deadly.
Then have a seat.
Thanks.
Right, so we literally just squeezed you in, haven't we?
Yeah, I really appreciate it.
So, company said infected insect bite?
Yep. Here's the original bite there.
Right.
Basically, it all flared up massively. I felt a bit rough one day, and the next day, temperature of 100, very hot chest.
Oh, right, OK. Did this happen a while ago? Because we've got an out of hours.
A week ago, yeah. And I
the 14th.
I went to an out of hours thing, because I phoned the 111 people, and it scared the hell out of me by saying, you've got an hour to get to the hospital. I was like,
I think by that what they probably meant was your appointment's in an hour, so you've got an hour to get. I don't think they probably meant an hour or that's it, game over.
They certainly didn't play it that way. She sounded a bit worried. I was like, Anyway, I had the antibiotics. It all calmed down. The day, the temperature's gone, everything gone. And it finished, and this kind of just totally disappeared, and then now it's coming back up again. And this sort of a rash started this morning. You see the dots over there, and it's sort of itching around
So this is the bite?
That's the bite there.
So this had completely resolved?
It appeared to have, yes.
So when did this bit flare up?
This morning, I went to the swimming pool.
Did you get out and just notice the whole lot?
I got out, and I felt an itch. I thought, God, that feels like the mozzie itch. I went down, and I thought, oh, no.
I mean, obviously, it's some kind of irritation, but...
Yeah.
I don't think it's anything to do with that bite. Pop your finger in there. Let's just double check. Take your temperature again. Yeah, so that's normal. Cool. Heart rate's normal. Oxygen levels are normal. I would just stick some moisturiser on it to try and help with the itch. You could take an antihistamine, cetirizine or loratadine, if at any point it does start getting even remotely like it was last time, so hot, swollen, really painful, give 111 a call. Just tell them that, quick, I've got an hour.
Absolutely.
But I certainly don't think you need any oral antibiotics by the minute.
OK, I had to check. Hey, thank you so much. Cheers.
Right, have a good weekend. You up to anything
Cheers, you
much?
too. Just visiting the parents.
Yeah. Well, have a lovely time.
Thank you.
See you later.
Bye.
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 What's the plan for the rest of the day?
Oh, Durham Park.
Lovely.
Yeah.
OK,
Thanks
all the
again.
best. Bye-bye.
Bye.
Say goodbye to Dr. Pelly.
Bye, Dr. Kelly.
Goodbye. See you later.